Hello, thank you for joining me today for this episode of Clinically Speaking. My name is Dr. Dawn Richards and I'm the Medical Affairs Director at Vitality Health. My background is as a GP. I think all of us have become aware over the last few months of the changes that have happened in access to hospital treatments within the UK, both within the private and the NHS settings. We saw the transfer of private beds across to the NHS to cope with the demand envisaged as a result of this COVID pandemic, and that obviously has resulted in the fact that some patients were unable to continue with their treatments. This has been particularly concerning for members who are having cancer treatments and undergoing chemotherapy in the hospitals, where any interruption to their care may bring about a less favourable outcome than if the care had continued in its usual fashion. So what we did at the beginning of this pandemic is that we contacted all those members that were having private chemotherapy treatment, and our Vitality Care team reached out to them all to see if their care had been interrupted by the changes in hospital access. Fortunately, I'm able to report that most patients were able to continue their care uninterrupted. For those minority that did have restrictions and problems with access to care, we tried to then see if there was anything we could do to enable their care to continue throughout the pandemic. So what we did know at this point was that chemotherapy can be delivered within the home, and this is a perfectly acceptable pathway. We know the sort of treatments that can be delivered in that way, how drugs can be accessed, how they can be delivered to the patients, how nurses at home can give them that treatment, and just as importantly, have safe aftercare support to look after that well-being should they have a side effect or a reaction to the medication or just generally need some health advice. With that in mind, we look to again offer healthcare at home alternatives for those patients that had their chemotherapy journeys interrupted. We work with the patients to see if this was something that was suitable for them and whether their consultant deemed that this was an appropriate treatment pathway for them. I'm pleased to say that over 2/3 of the patients that had their care interrupted were able to transfer to have home chemotherapy. And I think that was a remarkable achievement. In fact, we had one lady who was having treatment within a hospital setting who lived in a major city but wanted to go and live with her family in a more rural setting where there was less risk of exposure to COVID. And in that circumstance, we too were able to help her transfer her care from hospital to continue to have treatment via a healthcare delivery system at home. And that was very helpful for her, enabling her to feel safe and less at risk of exposure to COVID infection. So where are we now as we have in the UK, fortunately, the COVID epidemic somewhat settled at this point in time, although I do accept there are regional flare-ups. But we are ever mindful of a second wave that will come. So what we need to do is make sure that we look back and learn from the experience that have happened during this time, that we continue wherever possible to offer access to services in an environment where there is less risk of transmission of COVID or any other infectious disease. And to look to continue to offer treatment at home where that is possible and is clinically suitable and where the patient feels that is something that they are happy to deal with. And also to look at continuing to offer access to remote consultations and to support for members, and to think really outside the box about transforming traditional healthcare into this new world which uses all the resources available to it. And to offer patients real choice in determining how they access care. So I'm very happy pleased to say that we will continue to offer access to chemotherapy treatments at home, and we will be working to look at solutions in the future to help our members access them. Thank you again for joining me today. It's been a privilege to talk to you all, and please listen out for the next clinical session that will be advised on the Vitality Advisor zones. Thank you very much. Goodbye.